I think we're beginning to get a picture of this integrated approach, including teachers, including other pupils, including dental students. And I think the school nurses play a very, very important part. And it's maybe something that needs to be helped and shaped, how that can be a synergy in achieving better oral health and, in fact, better health generally for our school children. We've got some Q&As, and this is open to all the speakers. I'm looking at some of the questions people have posed. We've had one from the Middle East, which is about resistance. Did any of the speakers find resistance from school authorities or from parents about introducing toothbrushing in schools?
Yes, we found that I was looking at the questions there. We don't really get resistance from parents. You know, they're quite happy with it. You occasionally get resistance from a head teacher though, because they might not see it as a traditional education, you know, sort of activity. But that's the only thing that happens sometimes to us.
Okay, thank you. Sonia, did you find resistance in Brazil?
Yeah, we have resistance from the teachers because they think they receive very low salary, and to put this all one more thing for her, it's too much. And we have to adapt ourselves to their daily activities, not to disturb the class. So that's important that we stay the whole day and not disturb the activities they have to engage them in our problem. And one other thing I would like to say that on the 7th grade, they study science, and this study there is on the books oral health. So that's a way that we can also try to decrease this resistance, but it's not easy.
Okay, thank you. Anyway,
Roman.
Sorry, Jaime.
Well, in our experience, the resistance was from the authorities, saying that the teachers wouldn't comply, but we were very surprised that it was the other way around. Many teachers said, you know, this is something that was missing. And so it was more from the head of the teachers. But once it permeated down, and again, as I told you at the beginning, the smaller the children, the teachers were more, they embraced the program easier. You know, with the older kids, it was more a problem of control of discipline, because at the beginning it became like you know, it looked disorganized. But once they get into this daily thing of repetition, then in the schools, we haven't had that problem so far.
Okay. And Mahesh, in India, I was very impressed with the fact that we're teaching brushing as a routine behavior, and these midday meals seemed like a very good hook to put this into. So can you just share with us a little bit about the midday meal scenario that happens in schools in India, and how toothbrushing could be slotted in there?
Yes. You know, midday meal, it is mandatory that the meal is cooked. You know, it is all support is provided by the state governments, and the meal is cooked very hygienically in the school, and it is served you know, to the school children. And most of the school children don't carry the tiffin; they don't carry the lunch to the school. And also, you know, it is not just meal, but I think it's planned in such a way so that entire nutrition is taken care of. But I would like to share with you that there have been instances in India that you know, sometimes some of these activities which involves some intervention on children have been registered by the parents, where they say that and you know, because of that, mostly whenever there is some intervention, immunization or any such intervention is required, then usually the teacher would ask the child to bring a kind of a consent, or the consent is sought from the parents, because sometimes, they say that it was done without my consent. So, because we have all kinds of, people in the society, especially with the more liberated thoughts now, there have been instances. It's a very good question that we not think it is implied consent, the very fact that they have sent the children to the school, that we can ask them to do some of these, even though very, very useful activities, but I think somewhere the consent is taken from the parents. Yes.
Good, thank you very much. We have a question, Rosario, for you about how do you think that school nurses and the dental community could work closer together?
Great question. The best way to work together, in my opinion, is to find a way to have common and shared places where perform activities. For example, I think that the scientific society of the dental community and the nurses could be very helpful to help to integrate multi-professional perspectives in one plan to action. So in my opinion, it's basically a cultural barrier sometimes to find the energy to work together to face with the same problem. And I think that scientific society, professional associations, and also the demands from our stakeholders are often common. So considering that the demands are common, of course, we have to find a systemic modus operandi to work together, to work closely together, because sometimes the problem is related that working together is something of extra routine, extraordinary. So we have to find a way, find programs, find strategies where working together is just a routine, it's just a common practice. Because when we put together different professionalities, different perspectives, we contribute a lot in create the ecosystem that is needed to promote health. So this is this is what, in my opinion, is very important to incentivize collaboration among professionals.
Good. Yeah, so thank you very much. I agree with that. Our time is coming close to an end, and I'm going to give each one of our 5 speakers just an opportunity to underline one of the key things they think is important as we consider toothbrushing and other oral health programs in school. So Alex, if we start with you.
Hi. Well, we were thinking about improvements to the program in future. One thing we're worried about is if they brush the teeth in the morning, you get children that come to school in the afternoon. So we should keep an eye on that. And we're going to lower the age of the toothbrushing down to 2 years old, hopefully. And also expand the toothbrushing into what is currently the school holidays. So there will be nursery school education during what is now a holiday.
Good, thank you very much. Mahesh?
Indian, geographic and population is quite similar to Mexico. And I think, we should integrate toothbrushing, mandatory toothbrushing in, with our midday meal scheme and hand hygiene, midday meal scheme followed by toothbrushing. I think if, this is something which is need of the hour, and if this is something like this can be done through legislation or by some means, I think this will be a great way forward.
Good, thank you. Jaime.
Thank you, Herman. Well, I think that there were two key issues here. One was make them feel that toothbrushing had always had to be in school. It was not a new thing. It was, in some instances, a budget thing, because soap and paper to wash your hands and water is normally in school. And the toothbrush and the toothpaste has to be added. And in underserved populations, they don't have the money to get it. So we made them feel that it was it had always had to be in there, and it, you know, we were correcting the story. And number two, I think that programs that don't have a lot of dental influence is the future, because dentists are given the role of restoring or keeping the health of the patients, and they normally don't have the time for education and education in prevention. And not in many countries there are hygienists or dental nurses. So I think the teachers, when they understand, they're going to be a very, very important stakeholder for the future of good oral health in the world.
Thank you. Rosario, is there some final comments you would like to make?
I think that we have very clear in mind that schools are places where we have to, are the places where health promotion should start. So giving this in mind, when we have in mind, or we have the willing to go ahead with programs related to oral health, to toothbrushing, etc., we have to very clearly consider that that we have to intercept together healthcare providers and educators and managers the demand of health from our stakeholders and move with common and shared programs. When we start a program, we have to move together. And this is what I experienced when we succeed in some programs. When we start together, because the barriers is at the beginning often of the resistance in some programs are at the beginning of the experiences. But when it become a routine, I have experienced that everything moves to succeed. This was I want to share with you as a whole.
Yeah, thank you so much. Sonia.
I think we all agree that school-based toothbrush is something very useful and good for health, and the habit from the young age will develop adults with health habits. But I think as it was also said, it's necessary to motivate, not only to inform. And I think when we motivate, it's important to let it clear that toothbrushing, it's not only for caries, but it's for health in general. So when you can join this with other programs, we get more success and more acceptance, I think. And that's still, it's very important. And we also need to look for, at least in Brazil, for private partnership in order to increase this program.
Good, thank you very much. If we have the next slide, the take-home messages. I want to thank all the speakers. I think it's been very good, and it's been very diverse backgrounds. I think one of the things we want to get over, and I think we've learned today, is there is a global oral health crisis in children, and we can't neglect that. And it's not the responsibility of just the dental community. It's not the responsibility of one individual or groups of individuals. It is everyone's responsibility. And we have to, and what Scotland have shown us is the improvements we can see in a school-based toothbrushing program with a fluoridated toothpaste. The difficulty is that so often that is placed in the health budget or an external budget. And what India has shown us is that it's a part of daily routines. You have your midday meals, that's provided by the educational system. You wash your hands beforehand and you brush your teeth as well. That should be part of an integrated approach to providing good care. But also we've learned that from Rosario, the importance of including the school nurses who have a role to play within schools and integrating their work and their messages to improve oral health. And they should be part of the team, as should the teachers who introduced brushing into the curriculum. No child knows how to brush their teeth. It's not an intrinsic behavior. They have to be taught to brush their teeth. And of course, parents undertake that role, but it has to be reinforced and supplemented at a school-based level within the curriculum and within everyday habits. So these are the take-home messages for me, that school-based education has so often been parallel and undertaken by parachuting dental teams into schools, when actually the best way is to integrate it all within integrated structure with school nurses, teachers, parents, and also within the daily life of a school. I want to thank everyone again for this interesting